So pain on the outside of the elbow here, we call that lateral epicondylitis, or commonly called tennis elbow. So you can actually treat this at home. All the muscles in the extensor group here on the outside of your arm all have one common tendon, which is one of the reasons why it pulls on that tendon. It creates little micro tears and creates that real pain to improve the blood supply on those muscles in your forearm. So by grabbing a little bit of oil, moisturizer, we're going to start off by working these muscles in your forearm, all the way from your wrist all the way up in towards your elbow. You start off quite light to spread the oil, and then you'll slowly heat up the skin and the muscles below it. You can press harder and deeper into those muscle groups, starting from your wrist, working all the way up into your elbow. So once we've worked into the muscle, we can try and take the tension out of the muscle by trying to stretch it. And we can do that by you starting with your palms up towards the ceiling, you cross them over, pull down with the hand underneath, which is putting a stretch onto the muscles in your forearm. And we try and hold that for about 20 to 30 seconds. Because it's a tendon problem, the tendons like to be strengthened, like to be loaded. So there's different ways that we can do that. So I like to use either a resistance band or a weight. You can lean over your couch or onto a table. You tie the resistance band onto the chair leg or the table leg, hold it in your fist, and you'll slowly extend it up. So you're taking your wrist up towards the ceiling and you are extending these muscles, which is putting a lot of tension on that tendon. And it might sound counterintuitive because it's obviously painful there, but we're actually adding some strength through your lift and hold. So that's called a concentric contraction, where the muscle is contracting to pull on that tendon to lift your wrist. Muscles also work using an eccentric contraction. So that's when the muscle is under tension but is being lengthened. Now, to help to do that, we're going to assist your target wrist into extension. We're going to hold that and then slowly let that lower on its own. So the muscle is remaining under tension, but it's being lengthened. We can do the same with a weight. So you hold the weight in your wrist, you hang your wrist off the edge of the table, and then you will concentrically lift the weight up towards the ceiling and then slowly lower it back down. If we wanted to target and focus on the eccentric load, we will assist your wrist up towards the ceiling and then slowly control that down. Predominantly, the elbow is a flexor and extender, but also it needs to pronate and to supinate, as to push or to pull or to rotate. Hold the weight off the edge of the couch and then you can rotate. So this is called pronation, to push down, or supinate, as to push up towards the sun. And this is rotating what's called the radius over the ulna. If we imagine all the muscles run up your arm and then there's this common tendon, your brain knows that this is where the attachment is. So we can try and trick the brain by changing that attachment. So we can use this elbow strap or epicondylitis strap. You see there's a pad underneath. So that pad is going to push onto your muscle. So you'll place that pad on. Got some Velcro straps. You pull quite tight because you want the brain to recognize that there is a new attachment point and not there. So now between your elbow and this elbow strap is taking the tension off. Try those exercises and let me know in the comments if they've been of any use to you.